today in our patient rounds, we talked about what do we do after a joint replacement. This is kind of a two-part series where we talked about what to expect with goals and things afterwards. And the big thing that we spent a lot of time on is the immediate post-operative recovery and what we do after that joint replacement, day 0, day 1, day 14, even up to day 90. We really had good collaboration today talking about different ways to mitigate swelling, and I think that's where we spend most of our time today. We get really excited about the idea of let's get rid of pain, let's get back to walking, let's get back to our goals. Yes, very, very important, and that's kind of our part 2 that we're going to discuss, is what can we do long-term afterwards. Realistically, the immediate post-operative area is what's going to set up what we can do afterwards. Some of the discussion that I really liked that our therapist brought up today was talking about kind of our pre-surgical expectations and setting those, understanding that there's going to be pain, there's going to be swelling, and we need to recognize if we feel good and everything seems right, can't we just go to town, so to speak, and just really do all that we want to do? And realistically, that is actually counterproductive. And so we talked a lot about mitigating that swelling with our exercises and activities. I spent a lot of time talking about the wick line protocol is what we call it. The March to 2 million joints, if you look that on the website, the idea is 2 million patients having joint replacements with less than 20 opioid pills. And the backbone of that is pain reduction is through swelling reduction. And so some of the ways we talked about that is reducing our activity in the initial state, kind of 40 minutes per hour is really should be elevating, icing, and resting it. And the other 20 minutes per hour are the simple exercises, ankle pumps, and heel slides, standing and doing about 5 to 60 steps per hour, where we can still get motion. Because again, this is kind of a tightrope. If you move too little, you're going to be stiff and have little swelling. So that's good, but stiffness isn't. If you move too much, you'll have good motion, but you're going to have a lot of swelling. And so it's really finding that balance. And this protocol that we give at Summit Brain Spine Orthopedics kind of helps reduce that swelling. And as we can reduce that swelling, your pain's going to be better, less opioid use, and all of those things are going to cause that long-term ability to improve. Some of the other discussion that we had, how we can actually make things a little bit worse as providers, as therapists, and even as patients, that if we are feeling good, we can kind of push patients a little bit more. One of the therapists talked about the patients who do surgery and then immediately come to therapy, they actually scare him. And that's kind of interesting to hear from a physical therapist, that those who come to therapy that early are a little bit worried, not because the patients aren't motivated, but more so that they're nervous that they're too motivated. And by too much motivation, they potentially will have more swelling because they're doing too much too soon. A lot of the stuff that we talk about with our protocol to reduce opioid use, to have better outcomes long-term, to get back to doing all the activities you want to do, is actually the initial 14 to 90 days of that post-operative improvement. So really focusing on swelling is what we talked about today. And I think there was a lot of good collaboration. And the idea being that we just want good outcomes for our patients, and we can focus on those things that we can control. Obviously, we can't control the little day-to-day things that our bodies do, but we can control swelling a little bit. It was interesting to look at the literature where we talked about how some patients, if they're in the higher percentile of swelling, will actually have 11% increased swelling 90 days post-operatively, which is, I think, more than most of us thought, with the idea being that if we can mitigate swelling earlier on, they're going to have less swelling long-term, which means back to normal recovery.